Hi, I'm Dr. Vinod Methil, consultant diabetologist at Sweet Clinics, Vashi, Navi Mumbai. And today I'll be speaking on something which has been in the media quite frequently in the last couple of weeks and has caused a lot of anxiety to a lot of people who have suffered COVID-19. I myself am also getting a lot of phone calls from my patients about this new complication, post-COVID complications, which is happening now, which is called as the black fungus, or in medical terms, what we call as mucormycosis. So let me begin by saying that this complication, what we call as mucormycosis, it's a very, very rare illness. I mean, rare when I say is that before the COVID era, before pre-COVID, you can say, in my 18 years of clinical practice, I have just seen about 3 cases of mucormycosis. Now, what is happening now is after the COVID, especially in the second wave, there have been a little increased number of mucormycosis happening in the patients, in the diabetic patients. But still, I would emphasize that it is a very rare complication. It's not going to affect all the not going to affect the majority of COVID-19 patients. What exactly is mucormycosis? Mucormycosis, it's a fungal, it's a group of fungus which is commonly present in our environment. It's present in the soil, it is present in decaying foodstuffs, it's present quite in a lot of places. Now, who can get affected by mucormycosis? Now, it usually affects people whose immunity has been compromised, his immunity has reduced due to various reasons, and one of the big reasons is diabetic patients whose blood sugars are very high, whose blood sugars are uncontrolled, and diabetic patients who get this complication called as diabetic ketoacidosis. Then the other group of people which can be affected are people who have got cancer, people who have been using steroids for a long time, people who have undergone any organ transplantation, basically people who are taking drugs which can suppress their immunity. One thing I would like to highlight that it usually happens in patients whose immunity are suppressed. It does not affect any COVID patients who have had any mild infections, who have been treated at home, who have not taken any steroids. And as we know that majority of COVID-19 infections are mild, 80% of them are mild, and who get treated well at home without needing any steroids. So in this group of patients, it is not going to affect. Now, what is the cause of this rise in cases of mucormycosis, especially in the COVID era? Now, one big important reason which has been mentioned is the use of steroids. Now, mind that steroids are life-saving, especially in COVID patients whose oxygen has levels have gone down. So, in such group of patients, steroids are recommended, but they need to be given in the right doses and for the right duration of time. So, when steroids are used unwantedly, and in a very high doses or for prolonged periods, it can increase the risk of you getting this infection. What happens with the use of steroids is basically steroids, it has got 2 effects. First, it gets your immunity down so as to reduce the increased inflammation which can happen because of COVID. And the second impact of this steroid is that it increases your blood sugars. This can happen even in non-diabetic patients who are at an increased risk of getting diabetes. So when these two get combined together, the reduced immunity along with uncontrolled high blood sugars, it increases your risk of getting this fungal infection. What are the symptoms? The symptoms are basically the patients can come with a blocked nose with a bloody discharge from the nose. They can also complain of pain in the around the sinus regions, pain in the eyes, and then they get swelling, unilateral swelling of one side, and then headache, usually unilateral. These are the very common symptoms which can happen with mucormycosis, and if you get these symptoms, it's utmost important that you go and consult a doctor to get yourself investigated. Now, how it is managed, once you go to a doctor, the doctor will do the necessary test. They can do a biopsy or a staining to look for the fungus, and once this has been diagnosed, then the approach becomes multifactorial. A lot of things are involved, and accordingly the doctors might involve an ENT or an eye specialist or a neurophysician and recommend the appropriate medicines, and if surgeries if required, to take care of the illness. The mucormycosis, it's very much treatable, but it's important that the treatment starts early. So it's very important that you go to a doctor early to get the diagnosis done. And how you can avoid this is especially true for diabetic patients, where what we have seen is that in the COVID scenario, the sugars can shoot up very high. So it's very important, the diabetic patients, that they do a frequent blood glucose monitoring, and if they are on steroids, they consult their doctor, and according to the blood sugars, the doctors will advise you insulin or tablets so as to keep the blood sugars under control. So keeping the blood sugars under control is one way where you can actually mitigate the risk of getting this fatal illness. So as I've said before, this is a very rare complication. It's not going to affect most of you, so don't get anxious, but watch for symptoms and approach a doctor at the right time so as to you can get the right treatment. Thank you so much.